Welcome to Pennsylvania in Focus. I'm Kristen Smith, and joining me today is the Center Square's Pennsylvania reporter, Christina Lingell. Hi, Christina. How you doing?
Hi, Kristen. Good, thanks. How are you?
I'm doing well. So we talk a lot about rural healthcare here in Pennsylvania, especially the fact that we don't have enough doctors in rural areas. And I think for context, too, it's important for people to realize that 2/3 of Pennsylvania is considered rural. So we're not talking about just along the borders of our state. And so it's a big issue, which is why we report on it all of the time. But one day, a doctor who's really going through it firsthand reached out to you and said, if you really want to know what this is like, come out and see it. And can I just say before we get into this that I really admire his gumption. So doctor, if you're out there listening to this, thank you. This was a great opportunity and Christina's a great reporter to do this. So with that said, let's get into what he told you and what this experience was like.
Yeah, so he is actually working in LaPorte, which is in Sullivan County. It's the county seat. And Sullivan County, I've heard it described as Northeast Pennsylvania. I guess technically that's what you would call it. It's kind of north central. It is farther to the east. In Pennsylvania, I think what a lot of people outside Pennsylvania don't realize is that what we call central Pennsylvania is still pretty far to the east. And there's a lot of rural to the west of that. Yeah. So it is technically Northeast Pennsylvania, but I think if you were driving through Pennsylvania, you might think of it as central. So anyway, Sullivan County is home to about a little less than 6,000 people, and their population continues to dwindle and continues to age. So there are a lot of health issues, not only, the regular health issues that we're dealing with as a country, like diabetes and obesity, the opioid crisis, all these things that are kind of affecting everywhere. But that aging population has all of the, expected health concerns that older people have. So there's a lot of need, but then very few people to meet that need. Very few doctors and very few people of working age in general. So it's kind of created a cyclical effect there where there aren't people like doctors there to draw in more people to move there. And it kind of just continues to drain away the population where people who are younger don't really feel a lot of pull to stay there. So Dr. Schrock is actually someone who did feel the pull to stay there. He was originally from Clinton County, which is another fairly rural county in Pennsylvania. He grew up there, joined the National Guard, did a whole lot of things before he ended up going back to school to become a doctor, and ultimately did a residency in Williamsport, which isn't too far from Sullivan County. Again, if you're not from Pennsylvania, you might have heard of Williamsport as the home of the Little League World Series.
And now a great brewery. How does it fall out of my mind? New Trail.
Oh, yeah.
Yeah, New Trail's a great one. So if you're a craft beer drinker and you've seen that and you like it, that's Williamsport.
Yeah. And it's about a little less than an hour from LaPorte. And that's actually like one of the nearest places where they have a big hospital. There are two smaller hospitals, both 40 minutes in either direction from LaPorte. So he's the only doctor for a really, really big space of people. And because of that, he's essentially said, I'll be working till I die. There's not a lot of people coming in here to take up the mantle of what I'm doing.
And right. And then when he's gone, then what? You've got even a bigger desert, as they call it. But, the state is well aware of this problem. And so we have things that are pending to fix it, right?
Yes. So currently we've got a bill that has passed the House. And so if it clears the Senate, the governor has said he will sign it. It will be offering tuition reimbursement to students who choose to work in a rural area for at least 3 years following their medical licensure, whether it's doctors, nurse practitioners, nurses, dentists, and dental hygienists, because there's also a pretty big lack there. They have done similar things with behavioral and mental health, and they found that it's been really helpful. So that's really one area where they're just trying to incentivize people to go there with tuition reimbursement. And they're really hopeful because generally, if someone has had the experience of being placed in a residency or some other sort of capacity in a rural area, they're more likely to pursue that. So most people who just haven't experienced it, just hear rural healthcare and are kind of turned off by the idea. But when you do get to experience it, I think there are some key differences that really make it stand out from more urban healthcare. Specifically, rural healthcare practitioners tend to be more of those kind of like old-fashioned doctors that do everything. Mm-hmm. They have some expertise at, the whole body. Obviously, they're still going to refer you to, if you need a hip replacement, they're going to refer you to an orthopedic surgeon, but they're there to kind of take care of the whole patient and have that sort of doctor-patient relationship that I think a lot of us think of from days of yore. Whereas in the urban centers, people tend to be more specialized. And that's something that Dr. Schrack has said he really enjoys about his practice. Of course, in rural areas, you're still dealing with the same issues that medical providers are dealing with everywhere. And that's a whole host of things from like red tape and dealing with insurance and getting authorizations. Even in the rural areas, most of the practices around Dr. Schrack's area, like most of the hospitals and medical centers anywhere near there, are owned by either UPMC or Guthrie or Geisinger. So there's that sort of corporate creep in those areas as well. And there's the kind of growing dissatisfaction we've seen with patients that has caused some conflict and caused really increased burnout for medical professionals has, that exists in rural areas too. So it has a lot of the same struggles, but it does offer a different experience, I think, than doctors practicing in Philadelphia or another area like that.
Well, Christina, thanks for giving us some insight into what's really happening on the ground. To follow this story more, check us out at thecentersquare.com/Pennsylvania, because you can't get lost in the homepage there. You got to come directly to us to see what we're covering, and you don't want to miss out. All right. Have a good day. Thanks.